All right, we're back here live. I've got the impression coping ready to go in now. This was derived from picking up the copy from the temporary. Okay, so let's go right in the mouth and insert this. We'll use a microsuction first, and then we'll hand tighten the impression coping, which is now modified for our patient. And we'll go ahead and open. She's had a certain amount of tissue collapse, and now we're suctioning that out. We're going to also just put a little bit of water in there, maybe some warm water, just to keep that clean. A certain amount of collapse occur, but that's okay. Not a lot of collapsing, just enough to say, hurry up, doc. Okay, so we got a little water coming. We'll switch this. And we'll switch it back. I'm going to put a little cotton roll up in there if that'll fit. There we go. And then we'll be blocking undercuts in her bridge, undercuts in between her crowns. There's a lot of little things I've got to do still. But let's show you how we put this coping in. We're just going to go ahead and rinse that out. Just making sure that there's no debris in there. We'll switch over to microsuction. All right. Okay, that's cleaned out. And we go with our impression coping. Now I've marked the buccal with a black marker. So we're out the facial aspect. And you're gonna feel a little bit of a pressure here, Marsh. Just a little bit. You okay? It's just slowly going in place. Now there is tooth contact, so we're going to have to relieve that in the inner prox. So we'll do that with the high-speed handpiece. All right, just bring it back a little bit. And I got to trim the plastic a little bit more. There we go. Yeah. So you need the impression material. It's got to go in between the impression coping and the adjacent tooth. That's the mesial. Now we'll do the distal. I usually go about a millimeter and a half of open space. As to allow that impression material to go in the inner prox, a little zone. There we go. And then we'll rinse that off thoroughly and scrub it thoroughly. And rinse it again. And then we're going to hand tighten that one more time. And you see how that impression coping is standing up nicely. And you can hand tighten it a little bit more and it's going down more. That's because it's not touching the adjacent teeth. That's about where we want to be today. So now we have to plug in between the teeth. And so we're going to use a material again from Ultradent. It's like a plumber's putty. It goes in between the teeth and blocks out the spaces because we don't want the spaces to get in the way or pulling on any unnecessarily. Each embrasure space will get that. And just dry that. So it has to have a dry surface or it won't stick. And again, it's Ultradent Oraseal Putty. Again, dry that for me. Right here. Great. And just put a little bit in there. A little bit there. A little bit there. Now we're getting around a bridge. So you may be putting a little bit more. And many times I'll even put Vaseline around a bridge because you don't want to pull on it. Now on this lingual I'm going to put a piece of white wax on that because that's way too big for the putty. Now we're going to zip around to this side. In between some of her crowns here and here. Okay. It's okay to add block out. Makes everybody's life easy. Here comes the wax. Here's the Hollenbeck. Okay, and we're just going to adapt that to the lingual. Just like so. That's white orthodontic wax. Just push it in place. Don't worry about the palate. That should do just fine. Now we're going to sit our patient in a more upright position so that we can go ahead with our impression. The rest is straightforward. This is Dr. Jerry Cuomo. We'll see you next time with our impression and final cementing.